Okay, so look, these are the learning objectives for the workshop tonight. So at the end of this webinar, you should be able to discuss the modifiable risk factors for cognitive impairment and dementia, discuss protective factors which assist in building resistance against cognitive impairment and dementia, understand health promotion and prevention, and implement a health promotion campaign in primary care. Next slide, please. Okay, so at present, there's no cure for dementia, but research shows that the best thing we can do to reduce the risk of dementia is to look after ourselves physically, emotionally, and mentally. So what we're saying is aging well by living well. We're taking a life course approach to dementia prevention. So there's things that we can focus on from every stage of life, from even before birth to old age, that will help us build a strong and resilient brain and reduce the risk of developing dementia. The idea of living well is compatible with Aboriginal and Torres Strait Islander people's cultural values. This has been captured in the Good Spirit, Good Life, Quality of Life talk developed by members of our team led by Dr. Kate Smith. So this life course approach to dementia prevention is evidence-based, and the key factors are to grow a strong brain, strengthen protective factors, and avoid these preventable risk factors. Next slide. We know that some risk factors for dementia, such as increasing age and genetics, we can't change, they're fixed. But current research suggests that maybe up to 40% of dementia in the general population may be preventable. The percentage might be even higher for Aboriginal and Torres Strait Islander people because the risk factor rates are higher. Next slide, please. So we've talked about the case study of Auntie Molly in previous webinars. So just to recap, Auntie Molly is a 68-year-old woman and she lives with her son, Frank. After visiting the health service because of memory and behaviour changes, Molly was diagnosed with Alzheimer's disease. And a case conference was held with her GP, her health worker and other staff to discuss Molly's care. Next slide. But today we're going to focus on Molly's son, Frank. So Frank has concerns about his own memory. He's starting to worry that he's getting dementia. So he has a chat with Harry, who's a friend of his and a local health worker. And he tells Harry that he's worried about his memory. He can't keep track of what he wants to do. He's losing his keys and he's getting cranky with his grandkids. He's particularly worried because of his family history of dementia. Harry suggests that Frank attends an upcoming dementia education session being held. Next slide, please. Okay, so cognitive reserve is the brain's ability to cope with damage and find alternative ways to process information. So the evidence shows that people who use their brains a lot, whether that's more education, more social interaction, maybe it's learning a new hobby or a skill, or working in jobs that are stimulating and mentally challenging. People who do this, they have more resilient brains. This is what we mean about protective factors, things that help strengthen the brain and help develop this cognitive reserve. However, even if you didn't have much schooling, don't worry, because education is really lifelong. It just means that you keep your brain active and busy and learn new things throughout your life. Then there's the modifiable risk factors. Here we're talking about the lifestyle factors that can damage brain health and limit that cognitive reserve. And generally they find that it will take a person with greater cognitive reserve longer to show symptoms of cognitive impairment or dementia than somebody who hasn't developed their brain as much, even though their brains might show the same amount of disease or pathology. Next slide, please. Researchers think that this is because people with high cognitive reserve have more networks or neural pathways in their brain. And it means that if some part of a network starts to break down, there's still options for the brain to adapt and find other ways around to get the messages through. In other words, the brain tries to reorganize itself to compensate for damage. Right, so on this slide here, we're looking at risk factors for dementia and cognitive impairment from this lifespan approach that we've been talking about. So if you look at childhood, the modifiable factors would include things like trauma and early life adversity, hearing problems, low education levels. In midlife, as we go across, you can see we're looking more at some lifestyle factors contributing to the chronic disease. Here we've got things like the high blood pressure, heart problems, kidney disease, as well as that ongoing impact from things like a hearing impairment and the psychosocial stresses. In later life, modifiable factors include stroke, epilepsy, delirium, depression, loneliness, polypharmacy, so usually that's if you're on 5 or more medications, and anticholinergic medications. Or there's these factors that are present throughout the lifespan, such as alcohol use, smoking, head injury, and especially the repeated head injuries that we hear about more and more in the news these days. Next slide, please. So on this slide here, this is the list of the most common dementia risk factors that we found in Aboriginal and Torres Strait Islander communities based on our chart audits of 1,653 people aged 50 and over in the Let's Chat study. So as you can see, many of them are associated with midlife chronic disease, high blood pressure, diabetes. But other things there, you know, smoking, polypharmacy, as well as depression and other mental health concerns. I guess the good news is most of these risk factors are potentially modifiable and amenable to interventions. We're not sure how much each of these risk factors actually contribute to dementia development, but the more risk factors present, the more likely someone is going to develop dementia. Next slide, please. So how can we build cognitive reserve across the lifespan? Well, firstly, if you look at childhood, a healthy pregnancy and a healthy, happy childhood helps build that brain capacity and cognitive resilience to damage. Things like keeping those kids engaged in school, making sure they get their hearing and their eye checks, and early intervention for those language and other developmental issues that mean that kids tend to disengage from the school system. Good physical and mental health, as well as how the brain's used in middle and late life, help to maintain cognitive function and possibly protect against cognitive decline. So what we're saying is maintain a healthy lifestyle with regular exercise, avoid smoking, low alcohol intake, keeping a healthy weight. They're important throughout life, and it's never too late to start. With diet, there is some evidence of protection with a Mediterranean diet. What we're talking about there is a diet that's got a high intake of vegetables, grains, legumes, and olive oil, moderate consumption of fish, poultry, and dairy, low to moderate intake of wine, and a small amount of red meat. Also on the slide there, we're talking about education and employment, but also just engaging in cognitive activities that make your brain learn and create those new pathways in the brain. So it could be something like learning to play a musical instrument or a new cultural dance. And finally, maintaining cultural and social connections is very important. Now I'm going to hand over to Lauren, who will talk more about health promotion.
So I just like to acknowledge that the traditional owners of the lands that I'm presenting from today, the Gadigal people of the Eora Nation, and pay respects to elders past and present. So just on this slide, we're continuing on with a case study for Frank. As you can see on this slide, Frank goes and talks with Harry and discuss preventative strategies. Harry talks about early risk factors of dementia prevention and early intervention with Frank. So the health promotion and disease prevention message for cognitive impairment and dementia are similar for most chronic conditions. So the primary preventions are eat well, engage in physical activities, drink reasonably, maintain a healthy weight, not smoking, participating in meaningful and cultural and social connections. And the secondary preventions are maintaining optimal diabetes control, maintaining healthy blood pressure, and managing cholesterol. So brain health begins from childhood. It is a lifespan approach. Build a healthy brain and maintaining a healthy brain during your lifespan. Primary care has a key role in providing healthcare and support services throughout the life course. Health programs which impact on neurodevelopment, cognitive reserve, and dementia risk include antenatal care, so optimizing the in utero environment, including preventing fetal alcohol spectrum disorder, early childhood services, including developmental tracking, assessing readiness for school, and supporting engagement in education, preventing and treating middle ear disease, and effectively managing hearing impairment, parenting and family support services, alcohol and other drug services, and a broad range of mental health, social, and emotional wellbeing services. So Neura has a fantastic online dementia education website for Aboriginal and Torres Strait Islander communities called Caring for Spirit, and it can be recommended broadly. It covers all aspects of dementia education, including information on prevention. So on this slide, we have a screenshot of the Caring for Spirit website. And on here, you can see the Healthy Mind, Body and Spirit page. And on this page, there is information on reducing risk. And it also includes a resource page within the Caring for Spirit website, where there are many links to other resources for reducing risk of and preventing dementia. So the Caring for Spirit website can be accessed via caringforspirit.org.au. On the site, there was a link to the training modules. So on the Caring for Spirit website, you can access these, and they're specifically on dementia on Aboriginal and Torres Strait Islander communities. The learning modules are an interactive online training program featuring an exploratory non-linear progression across 4 modules, reflective exercises, voiceover narrations, and multimedia. The 4 modules include what is dementia assessment and professional support, supporting people living with dementia, and strong and deadly looking after yourself. So for the person and dementia, with dementia, and for their carers. The Caring for Spirit project team worked with Blacklock Media, an Aboriginal-owned media production house, to develop a multimedia presentation. So there's a couple of them throughout the training modules. And they can be found throughout those training modules. And so I'm just going to play you one of these, which is about looking after your brain.
Now you've learned about how important our brains are for everything we do, and we understand more about how our brains work and what can happen if different areas of our brain are damaged, it is easy to see why looking after our brains is so important. So let's learn about the things that make our brains healthy, and as a result, our minds, bodies, spirits, and communities strong. Exercise makes our brains strong. So what's your jam? Can you slam dunk? Do you run like the wind? Are you deadly with balls and bats? Like a bit of yoga? Or a nice early morning walk? Doesn't matter really. The moral of this story is just keep moving. Exercise is good for our brains. Our brains are soft, fatty bits of jelly inside that tough noggin of a skull, so we can injure our brains easily. Protect those heads. Wear helmets if you're riding. headgear if you're playing footy, that brain of yours is worth protecting. Some say you can't teach an old dingo new tricks, but research says that that is not true. We can learn things and keep our brains active at any age. Ever wanted to learn a musical instrument? Love a word puzzle? Like to try and smash through that 1,000-piece puzzle? Or learn a new craft? Keep learning. This makes our brains strong. Who loves big mob get-togethers? Big mob, little mob. Did you know that doing things together, building connections, yarns, games, stories, teaching, all these things are good for our brains? Another excuse for a big mob get-together, eh? As if we needed one. You can't run that troopy without clean fuel, eh? Our bodies are the same. We need good, clean fuel. Healthy foods, lots of water, and steering clear of all the things that clog the fuel lines, like grog or ciggies. Good clean fuel is a strong brain rule. Have you heard that good old saying, prevention is better than cure? Well, that's true when it comes to our brains. Our general health can impact on our brains. So staying on top of our general health is really important. Don't put off that health check. Go see the doc, make sure everything is in good working order, and try to look after yourself. Healthy body, healthy brain.
So that's just one example of one of the those videos on there. So you'll find more on the training modules. So now with this slide, we're continuing on with the case study on Frank. And so as you can see here, Frank is talking to Harry about the education session at the elders group. And Frank tells Harry that he's worried and that he's getting forgetful and irritable and thinks he might have dementia as well. But Harry speaks openly with Frank and says to him, "You have a lot on your plate with being a carer for your mum. We all forget things, and not all memory loss is dementia. There are many things we can do to maintain a healthy brain. Why don't I make an appointment for you to see Dr. Bill to have a health check and draw up a care plan to keep your body and brain as healthy as possible?" So dementia risk factor management includes reducing both the incidence, the primary preventions, and the impact, secondary preventions, of cardiovascular disease, renal disease, diabetes, and obesity, as well as increasing resilience and social and emotional well-being. There is strong evidence of the impact of early life adversity on lifelong health and well-being, and a range of other social indications such as engagement in education and employment, and the associated risk of dementia and frailty in older age. So the key messages from this webinar are: living well supports aging well. There are many protective factors that can increase cognitive reserve. Many risk factors for cognitive impairment and dementia are modifiable risk factors. Primary health care has a large role to play in promoting brain health across the life course. So just on this slide, we have some resources. So the top one will take you to the Let's Chat website, which has information about the project. So next one on this slide is health checks are an important component of preventative care. So we have here the MBS 715 health check. And the last link is the Caring for Spirit link to be able to see that website. So the next webinar for this will be on the 9th of February 2022, which will be on webinar 5, Health and Wellbeing of Carers for People with Cognitive Impairment and Dementia. So thanks for listening. It's now time for you to ask any questions that you may have.